everyone will emulate this. We need this cleanliness in order to fight this vicious coronavirus.
This message is brought to you by Ministry of Health and DMMU.
Here's some basic ways to protect yourself from coronavirus.
I hope everyone will emulate this. We need this cleanliness in order to fight this vicious coronavirus.
This message is brought to you by Ministry of Health and DMMU.
This is Coronavirus and You TV program, coming to you live from Prism Africa TV in Lusaka, Zambia. I'm Frederick Chitangala. Today on Coronavirus, I'm privileged to feature one of the most accomplished health system specialists, health system management specialists. But before I go to him, a bit of background information on what we are discussing today. According to the World Health Organization, the doctor-patient ratio in Zambia is pegged at 1 doctor for every 12,000 patients, as opposed to the WHO's acceptable standard of 1 physician to every 5,000 people. Data from the Ministry of Health right here in Zambia shows that the estimated shortage of doctors, nurses, and midwives, not talking about lab and lab scientists, lab technicians, pharmacists, pharmacy technologists, that is about 14,960. However, with the current projected population rate, the deficits more than double to 25,849 by now, and more than 46,000 by 2035. That is deficit we are talking about. And many Zambians who live in rural areas have to walk hundreds of kilometers to access the nearest health facility. The hospital beds per 1,000 population has been reducing since the 1980s, mainly due to rapid increase of population coupled with unmatched health system expansion. If COVID-19 cases continue rising at the current trajectory, will our health system be able to handle the pandemic? What health system improvements do we urgently need as a country? To help me answer these and many more very important and mind-boggling questions, I have Dr. Micheal M. Chanda, a public health physician, HIV specialist, and a health policy and systems development specialist, indeed the right person to answer my questions today. He is a strategic management and leadership development practitioner. He is both a researcher and a peer reviewer with the Tropical Medicine Journal and the Health Policy Journals of England. He lectures to postgraduate students in health policy and system development at the University of Lusaka. Doc, it's a pleasure to have you.
Good afternoon, Doc, and good afternoon, viewers.
Indeed. With that introduction about you, do I need to give you a chance to introduce yourself?
No, I feel very humbled. Thank you very much for the introduction.
Thank you. Just a brief update on the current numbers as far as coronavirus is concerned. As we stand right now, looking at the live updates, the world has almost 19.3 million cases. We're heading towards the 20 millions, and about 718 deaths, with 12.3 million recoveries. Zambia, as we heard yesterday, and of course in the next few minutes, we are going to have an update from the Ministry of Health that as of yesterday, we have 7,164 confirmed cases, 199 deaths. That puts Zambia to be one of the highest in terms of case fatality rates. And of course, yesterday, as we all heard, we had 23 deaths. 21 of them were brought in dead. The good news, however, is that we have almost 6,000 recoveries, leaving us with only 1,179 active cases. If this recovery rate continues, and of course, if we work on prevention, there should be a time when the number of people admitted should start going down. Doc, before we get into a detailed discussion, first and foremost, let's appreciate something here. Since the breakout of this pandemic, specifically in our there's no country that anticipated this outbreak, by the way. But when you look at our own nation, so far, how do you describe the response from mid-March, when we had the first 2 cases, to date?
Thank you very much, Doc. And initially, we need to appreciate what is currently going on in terms of response before we can look at what else can we do. We do appreciate that the government, through the leadership of the Ministry of Health, has done a lot by way of, one, creating awareness around the pandemic, and number 2, playing an advisory role to the other sectors around the same epidemic. We must also appreciate that the government, through the disaster management under the Office of the Vice President, has done a commendable job as well to look at the COVID epidemic or pandemic as a disaster. And the other ministries as well, the Ministry of Education, Ministry of Finance, giving us the stimulus package. Having said that, I must be quick to delve into the area where I am comfortable, and this is the area of health systems, health policy and systems development. In order for us to appreciate the effectiveness and efficiency of the current response, it is prudent, Doc, to first appreciate what do we mean when we talk about a health systems approach.
Absolutely.
That way, we will be able to either judge favorably or unfavorably the current response. That way, we should be able to appreciate the positive aspects of the current response and identify areas needing improvement, so that together as a country we can respond much better. When we speak of a health systems approach, we are talking about a type of approach which is systematic in the sense that it embraces what the World Health Organization calls the building blocks of an effective health system.
That's right.
Let me quickly summarize these 6 elements which must be present in a health system that is efficient and effective. And in order for us to quench the wrath of the coronavirus,
Or any other
pandemic for that matter, thank you, Doc, we need to appreciate the building blocks. Number 1 is leadership. And when we talk about leadership, we are talking about institutional leadership. We are not talking about a person. We are talking about a leadership that is institutionalized at different levels. At national level, provincial level, district level, and indeed at community level. And this should permeate through all the sectors. Number 2, there is what we call health workforce. We need to have the right numbers of people to work, the workers, to respond to the epidemic. And they need to have the right...
So the right
numbers,
quality.
And the right quality, meaning the right skills.
Yes.
It's one thing to have the numbers, it's another to have the skills, requisite skills. Number three, this health workforce is not there for itself. It is for a third pillar, which we call services delivery.
Perfect. So
And
workforce, now service delivery.
service delivery. And the service delivery is divided in two broad categories. There is what we call health promotion, there is what we call disease prevention, there is what we call curative measures, where we fail to prevent, we cure, and there is what we call rehabilitative services. All these four categories need to have the right people with the right skills. So that is service delivery. Now, this service delivery, with respect to COVID, involves one, in health promotion, we have seen a lot of health promotion messages on the TV, on radio, like we are doing now.
Yes.
And then we have got, you have heard of when people get sick, we have got isolation sites, there are doctors there, there are nurses there. Those are now health workforce providing services to the people. But we need to have a lot more, when we come to the definition of health systems, conclusion, you see that there is a lot more that we need to do. After this, we now go to another pillar, which is known as information management system. In health, we generate a lot of information, and this information needs to be collected at the right time. Information about the patient at individual level, information about household level, information about community and national level.
Yeah.
You are giving us statistics, that is part of information management system. After information management system, we have now what we call laboratory supplies, pharmaceuticals, and technologies. So we need to know which drugs we have to support people that are on treatment.
Absolutely.
In order to, we don't have a cure, but we have drugs that can support. We have laboratory services, and hence we talk about testing. People have been complaining about the turnaround time and stuff like that. It falls under laboratory services. Technologies, and we are evolving every day in terms of technologies. And after that, all these elements require financing. And the last element talks about financing.
Yeah.
That's where we need the money. You have seen people making donations. You have seen people pledging donations. When we talk about financing, I have personally gone beyond just money. We now talk about resource mobilization, utilization, and accountability. And this one is critical, because unless we account for resources, them that are giving us resources will find it difficult to give us.
Absolutely.
The World Health Organization has added another pillar which talks about people, the beneficiaries themselves. Okay? So these are the 6+1. Now, to answer your question, how are we responding? The question should be, have we quantified the type of leadership we need at every level? And this leadership should be a product of objective stakeholders analysis. And this leadership should come, one, from the economic sector, the political sector, the environmental sector, the legal sector, and all the others. Because health is not just the absence of disease, but a state of complete mental, physical, emotional, and social well-being, and not merely the absence of disease and or infirmity. And we begin to see already that the creation of health and disease lie outside of the health sector. They are found in sectors outside of the health sector. For this reason, we need to include the leadership from the other sectors where the determinants of health are coming. To answer that question, we haven't done very well in that regard. Because although there is a stakeholders forum at the Zambia National Public Health Institute, this should permeate society at every level. The community where I'm coming from, there is supposed to be a platform for leadership. Even here where we are at Movie, there is supposed to be a platform of leadership. Have we done a stakeholders analysis to respond to the definition of health systems, which is, one, it is about people, structures, mechanisms, and their resources that are brought together to improve the quality of health. Have we done a stakeholders analysis? Have we done a classification of stakeholders in terms of, one, their capacity to participate in whatever mandate or area of disease promotion, health promotion, disease prevention, curative, and indeed rehabilitation? The answer is most probably no. And this is a gray area where now we invoke institutions of higher learning, research institutions. It's an opportunity to get into that area. Absolutely. So that we identify the strengths, the weaknesses, and the gaps, and use them to help the government as the leader in this fight to advance the agenda of overcoming the onslaught of a fully fledged coronavirus epidemic, if indeed it was to come to this country. Oh, wow. Thank you, Doctor.
That's a very important background. Now, Doctor, and this is now a very important question following what we have just talked about. Now, imagine right now as we are talking about, the Ministry of Health is updating the nation on the current on the update in terms of numbers. Now imagine the cases continue rising the way they are rising right now at the current trajectory. Given what you have said, will our health system be able to handle? Yes, we may have done something already, but if this gets worse, where are we going?
Thank you very much, Doctor, for that question. The honest answer, I have served in this country as a doctor for almost 25 years. And it's not a secret. Our current health system is lethargic from the introduction that you had given. When you look at the health worker-patient ratio, we fall far below the recommended ratios by the World Health Organization. When you look at the budgetary allocation, we also fall below the Abuja Declaration of 15%. When you look at the complexity of coronavirus, it is an expensive disease, particularly when people become very sick and they get into being admitted to the level of wanting advanced life support. Yes. Our health system has no capacity to manage the full onslaught of a fully fledged coronavirus. And I am happy that the Minister of Health, the Minister of Health officials, and even the President have not hidden this fact.
Yes, absolutely.
That we have no capacity to manage this, and I do agree.
So just hold on your thought, Doc. Given that point, we know it's a weakness in our system. Can we turn it around?
Yes.
And look at it as an opportunity.
Exactly. What Corona has done is to lay bare our weaknesses. And one of them is that we are ill-prepared for fully fledged pandemics. We need to do better. We have what you call epidemic preparedness teams at district level, at provincial level, but it is time we evaluated their functionality or lack thereof. At the same time, we have an opportunity of seriously relooking at the funding levels of the Ministry of Health. I am very pleased to learn that we have in this country established the health insurance scheme, which is intended to have what we call universal health coverage. It is in its infancy, but I know of the team there. It's a team of young people, vibrant leadership there, and I hope it will grow into, it will see the light of day. So, but we are not yet there. The opportunity we have is that we are in the planning phase, and we urge government and we advocate for an increase in the budgetary allocation to the Ministry of Health. At the same time, we implore the private sector to look into investing into the health sector so that using the total market approach, some of the clients that overburden the public sector can find their way into the private sector. But at the same time, we have an opportunity, Doc, of calling upon our leadership to start right now the implementation of prevention measures, which in my opinion are very poorly being followed. The adherence to prevention strategies that have been set up.
So the prevention is being done,
yes,
in terms of dissemination of information,
exactly,
health promotion, but it's adherence to those guidelines.
Adherence to the if you go to town now, it's a sorry sight. There are very few people wearing a mask. Mm-hmm. Taverns are now open. Bars are now open. Funerals, people are attending funerals. I even saw what looked like a political rally the other day. All these things are breaking what should have been a strict law. In other countries, you can't.
Would you blame this on the first building block or health system that you talked about, leadership?
Precisely. Leadership is the most important building block. Doc, allow me to spend a minute just explaining on the importance of leadership.
Sure.
When we talk about leadership in health systems, we are talking about a leadership that invokes confidence in the people. Mm-hmm. To invoke confidence, a leadership institutionally must walk the talk. Here is a leadership like the one I was watching the other day. Political leadership allowing cadres without wearing masks to assemble in mass. Remember that in public policy, what leaders do and say becomes a policy.
That's right.
And it is more important than what the doctor like myself is talking about. Who are you? Mm-hmm. Number two, we are not enforcing rules in funerals. We are not enforcing regulations in places where people are gathering. Yeah. The leadership is poor and is not doing its role in the levels we are expecting it to do. That's why you can go to town today and there is nobody stopping people that are not wearing a mask. Anyone can go anywhere. Lumumba Road is full of Salaula sellers today. Soweto Market is full of marketeers today. And there is a leadership there. That leadership has not embraced the meaning of health in all policies. And it points to the fact that there is a lack of policy implementation and lack of effective policy execution at that level. And it begins not just with the Minister of Local Government, it follows with all the political leaders, and it follows with all the leaders in the structures where people are being found. Because this one goes beyond the political leadership. That's just one element in the health systems. It goes beyond the Minister of Health. The guy can't be everywhere. Yeah. It goes beyond the public health practitioners like it has to take leadership at every structure to induce or infiltrate their own systems of functions and ensure that prevention of COVID becomes part and parcel of their core business. This is not happening at levels we expect it to happen, Doctor.
I know that we are here to have a very good discussion, because I know the questions that are coming will definitely give us some insight on whether what we are missing or what we need to do in order to be where we need to be. Now let's be specific now by looking at how we have been overwhelmed by the demand for coronavirus tests. I think now everyone wishes they can test because this is a flu season, it's a cold season, you know. So demand is definitely outstripping supply, as evidenced by a very long turnaround time for test results. Now you test today, if you have no symptoms, or even if you have, because I know quite a lot of people that went in with symptoms, tested, they were told to wait at home and they isolate themselves. 2 weeks, 3 weeks later, they still don't have results. This question was asked to the Honorable Minister during one of the daily briefings. He just admitted, yes, we have a challenge, but we are working on it. Is this an indicator of a health system that needs improvement?
Yes. Remember that when we were talking about the building blocks, there is one building block where we talked about laboratory supplies, therapeutics, and technologies. So, test kits are a component of laboratory supplies. And test kits are supposed to be available as and when people need to test.
Yes.
So there is accessibility and there is availability. So if there is no, and affordability, when there is no availability, how can there be accessibility? So because they are not available on the part of the provider, the demand is there, but the supply is not there, accessibility is going to suffer. So the inavailability of the test kits in numbers that we need them is making accessibility difficult. And by the way, there is a direct relationship between the availability of test kits and the number of people that can be tested, and there is a direct relationship between the number of people that test and the yield that we get. The more people we test, the more people we get who are coronavirus positive. Now, having said this, I must be quick to qualify that test kits are a challenge globally. Even the US is facing those challenges, but this is not an excuse. It just tells us that we need to plan epidemic breakouts much better than we have done in the past.
You're watching Coronavirus and You, and today I'm featuring Dr. Micheal Chanda because we're discussing health systems and coronavirus in Zambia. You're free to call this program, to call us on the number that you're seeing on the screen, and we'll be very happy to hear either your question or your contribution to the topic of discussion today. But right now, I want us to go to the comments that are coming on the live broadcast on Facebook. Okay? The first one is Chiti says, everything is bordered on leadership and governance. And Claudia Kakombo says, we need to get back to the drawing board and do a SWOT analysis. Answell says, very encouraging, please tell your neighbor. Good. Okay, somebody is saying, that's my reaction. I don't know if it's me or it's you. It's interesting. And then let me go back now to a question that is similar to the questions that I'm asking today. This is a question I asked on Facebook yesterday, and go through what people are saying as some of the answers to the challenges we have in managing coronavirus. Crispin says, I hear you and we share the same pain. Government priorities are misplaced. We can actually see where government has placed its priorities, infrastructure development and not human capital. So the question I asked is, some questions I'm asking, if the coronavirus cases continue rising at the current trajectory, will our health system be able to handle the pandemic? What health system improvements do we urgently need as a nation? So Dr. Aroni Mujajati, I believe everyone knows this one, says the problem I have with these numbers is that the numerator does not include the private sector. Most statistics on Zambia exclude data from the private sector. I'll continue with this. Let me take a call from one of the callers. You are through to coronavirus, and you tell us where you're calling from and your name.
Good morning.
Good morning.
Good morning.
I'm calling you from Mwangu. This is Chiti.
Thank you so much. T, you are becoming our usual caller, and we love you. Thank you so much. Please go ahead with your contribution or question.
All right. First of all, I'd like to appreciate the energy with which Dr. Chanda is explaining things. It's very encouraging. So, first of all, do we have the ability as a health system to manage COVID? So, the way I had understood this is the whole system. I looked at the whole, for example, hospital setup. The lab, the ward, the clinical area. Do we have the human resource? Do we have the logistics? We are seeing frequent stockouts of various consumables. Testing has not yet been decentralized, as was promised about 1-2 months ago. That's why we are still overwhelming central testing areas. So indeed, we are missing out on the peripherals. It's like we continue to be using the phrase we shall. The corona is getting a grip on us, and we wouldn't want to get to levels like our countries have gotten to. Those countries who apparently are not have stronger health systems than us. So there's need to revisit each and every department of clinical areas and strengthen them. This is all about system strengthening. And we should not be afraid to invest in these things because it is the only way we shall yield results.
Yeah.
Let us see where we can get finances from and finance each and every department that is directly and indirectly in the fight against Corona.
Wonderful.
Because things are there to tell the truth. If Corona decides to hit us like it has hit us, we are dead. This is not a question. We are dead. We have relatives in Italy who have shown us pictures about how this has killed them. It's a sorry sight. And these are places which we now have very, very good quality health systems.
Yeah.
So we should not be afraid to die a little. Because the reason why we want to invest in this health is we want to preserve our lives and the assets that we have and the future generations. The next generation might just get wiped out if we are not careful.
Yeah.
We need to strengthen our systems. So at the moment, our health system, to say the least of ways, it's not doing enough. Thank you very much, sir.
Thank you for a call.
Thank you very much.
Do you want to quickly comment on Chiti's call before we go to the comments from Facebook?
No, it was straightforward.
Okay.
I do agree totally with Chiti. Thanks.
Wonderful. So I was talking about what Dr. Mujajati said. So he said most statistics exclude data from the private sector. When I further inquired on whether its contribution means that the involvement of private facilities on the COVID fight would improve health system capacity, he agreed. And this was also echoed by Dr. Shailene Desai.
Shailene.
Yes,
Yeah.
yes, Shailene Desai. And then, now, on the contrary, there's another comment from another person who says, well, yes, let the private and public sectors work out some partnership. But like the comments I've read so far, the private sector is in it for the profit. So it makes it hard. But if they did work together, it would help with this fight. Also, a bit off the topic, but COVID related. I heard from a relative that they went to get tested because they were exposed, and went to get tested for 1,800 kwacha at some private hospital somewhere in some Lusaka area.
Okay, yeah. Let me comment a little bit. Dr. Mujajati is right.
Yeah.
And so is Dr. Shailene Desai. Those are colleagues. And it's not just in COVID. In this country, through the Ministry of Health, we have what is called Health Information Management System. Unfortunately, some or most of the private sector activities have not been captured. For HIV, this is being captured now for most of the private sectors through smart care. But regarding COVID, there is quite a number of cases that have been diagnosed in the private sector. I know of some which may not be reported on time into the public health system. Remember, I talked about a system, and one of the building blocks talked about information management system. Yeah. And we need leadership at every level, including leadership to collect and use data, both from the public and from the private. Let me also add, the private sector is an integral part of the Zambian health system. The equation of imbalance of health systems will never be balanced in this country for as long as the private sector and the public sector treat each other like a game of dog and cat. The private sector is part of the health landscape response agenda. In one of my past jobs, we were dealing with what we called a total market approach, and we came up with a concept, which I'm very familiar with. We came up with a concept of a health systems-wide total market approach. This one requires that the public sector and the private sector all sit down together to identify the quantum or the size of the health burden, and to divide, to identify the segments which they are responsible for, and to have, at the end of the day, one reporting mechanism. I'm sure this is what Dr. Mjajati and Dr. Shailene are looking forward to. There is some work which currently is going on through the Minister of Health. There is a person responsible for private sector health facilities now. I hope and pray that at some point we'll have opportunities of engaging as a health policy and systems practitioners that person, so that we can promote the role of the private sector. In terms of charging, the public sector, the government has told us where we can do the test. But it is taking too long for the results to come.
Sorry, by the time you come back, I'm already recovered or have infected a million others.
And because of this, people are being forced to go to the private, where they will pay the 1,000. I know of a testing lab in Kalingalinga, private, where you can go, and for 1,200, you do the test, you get it the same day. I am not against paying. What I am for is let people receive results using the quickest route, and let all those who are testing be accredited, and I'm sure they are. And let them take results to the government through the Zambia National Public Health Institute, so that we know the totality, the denominator is known. That way, everything depends on the denominator, you know, Doc. That way, we'll be able to calculate the yield. Of so many tests that were taken, this many came out positive. Therefore, the positivity is this percentage. At the moment, what we are having may not be the total picture. Yeah, so that's what I can say about the colleagues have a point, and it needs to be taken very seriously. Number two, government and private sector, particularly private health facilities, there is need for us to improve the relationships and to take advantage of the opportunity that has presented itself to us through this unfortunate situation of the COVID pandemic. I look at it as an opportunity.
Absolutely. Please call that number, and we want to hear your views, your questions, because this pandemic is affecting everyone. At this particular time, if you don't know, or you are not affected by this pandemic, by either losing somebody you know, or your relative, or being affected by it yourself, and I don't know which planet you are living in. Now, Doc, still talking about the private sector, wouldn't it be wise for government to come together, private and public facility to come together and say this is a matter of national interest, just like they did with ART? When they said, okay, private facilities can give ART, they can give them smart care and all these things. You can charge consultants, but please don't charge ARVs because you're getting them for free from the medical stores.
Yeah.
Can't we do the same? Give them free test kits. Okay, if we had them as government, give them free test kits. Let them pay a bit of it for the time of the lab person working on that. Not 1,000, not 1,800. And when we don't have an advanced universal health system mechanism, we don't have an advanced social health insurance mechanism because it's only based on low-cost mechanism.
Exactly. In times like this is where you say there is a time and a place for everything. It's just a question of time. The pandemic is very new, and we are learning on a daily basis. Yeah. So I suspect personally, speaking just from the experiences of other epidemics and other diseases, it's just a question of time. Once we know enough, I am sure that the government and the private sector will trust each other enough as to allow what you're proposing to happen. My message to the government and the private sector is, and it's the government that is in the driving seat, I think that we need to do a lot more in terms of engaging the private sector with respect to the coronavirus pandemic.
Yeah.
I say so because there are some very small private sector entities which have not received a government representative since March, when the first coronavirus was diagnosed in this country. Now, we have a lot of policy-related issues. We have a lot of protocols that have come out, and I'm here seated amazed at just how this very small one-man, two-man surgery is managing corona-related cases. Yeah. So there is need for collaboration and constant dialogue. In order for this to happen, Doc, there are certain critical success factors that must be put in place, and these are compulsory. One of them, we need to have a very strong public-private partnership policy, spearheaded by the Ministry of Health. Yes. At the moment, it's not there.
It doesn't exist.
I'm a policy analyst. I understand it's not there because I've been looking for one, and I haven't seen one for the past 12 years. Number two, there is need to have a strategic plan of public-private partnership between the Ministry of Health, or between the public health facilities and the private. Number three, when we are planning at provincial and district level, we need to plan for the entire district, for the health of the entire district. What usually happens when Ministry of Health is planning at district level, it just plans for the public sector. Yeah. It doesn't plan, it doesn't invite the private sector to participate in planning. We are supposed to look at the disease burden of the district. And anyone who has a role to play, who is a stakeholder and is affected, is welcome through whatever mechanism of representation to participate in coming up with a plan to do health promotion, disease prevention, treatment, and rehabilitation. The same should have been happening with the coronavirus. We should have seen rapidly very quick development of strategic plans at district level involving multiple stakeholders, including the private sector for resource mobilization. Yeah. At times, we like to suffer when we are not supposed to be suffering. How are we going to mobilize resources if we don't have a stakeholders collaboration plan? How are we going to mobilize resources if we don't identify stakeholders who are potential financiers to come to the table at district level and be part and parcel of the solutions that we have to the issues that are affecting us? And one of them is inadequate resources. Doctor, we need to change the way we do things. And if there is one thing which COVID virus has done, it has taught us and it must teach us to think differently if we have to overcome the epidemic. This is my take about what this epidemic has done to us and how we should do things differently.
Absolutely. Let's take a bit of time, Doc, to talk about something that looks promising for this country for the first time. We now have something that we might refer to as one of the best opportunities for us to attain universal health coverage. Now, this is talking generally, not just about coronavirus. Look, we're talking about how expensive it is to have a test done at a private facility. If you had an insurance facility that can pay for me, that shouldn't be a problem. But the current social health insurance, even which I contribute to, and I believe you do, cannot pay for that.
Yeah, it's correct.
What hope do we have in this?
I personally have a lot of hope in the National Health Insurance Scheme. I have hope because a seed has been planted. Yes. It is happening for the first time. And like all things, in the initial stages, it may face a lot of challenges and uncertainties. Yeah. It has never happened in this country. And we should learn as we go. We shouldn't be scared to take calculated risks like entrepreneurs do. And I have hope because I see on my payslip there is a subtraction and a contribution I make every month.
The 1%, right?
The 1%.
Yeah.
I have hope because I know that we need to find, and we shall find, mechanisms of broadening the base of collecting contributions. The guy that is selling talk time should be able to contribute. Currently, he is not. We should be able to have some think tank to find ways and mechanisms of increasing that base. What is important and what gives me hope is that we have started. I've seen the vision of the National Health Insurance Scheme. It means, well, it is good for us. One day, Doc, we shall be out of employment. Yes. And the insurance scheme we are enjoying today through our employers won't be there. And we shall need the very insurance which we are contributing to. My grandmother, your grandmother at the village is not in gainful employment. So they will benefit from that one. My hope is that we shall continue learning. My hope is that unlike a lot of things which have not been evaluated, we shall subject the National Health Insurance Scheme to continuous monitoring. We shall subject it to process evaluation so that we learn lessons on both the efficiency and effectiveness with a view to make it work. It is ours and we must ensure that it works. One unfortunate thing that happened around the insurance scheme is what I might call the squabbles that happened between some key stakeholders and the Ministry of Health, stakeholders who felt that they were left out. I'm happy to see that that dust has settled, and we seem, all of us, to be supporting that National Health Insurance Scheme. I have hope, Doc, to see that we have started contributing. I have hope because they even have a suggestion box and they are already collecting. It's one of the beautiful things. You take a brilliant suggestion there, well researched, the guys are going to take it up and they shall implement it. And I hope that it's not just a question of a new broom sweeping very well, it is a value that they shall continue with going forward.
Okay, so I mentioned a while ago that while we were talking, the minister was updating the nation on the new cases, and here is where we stand. Zambia has recorded 275 new cases of COVID-19 out of 2,034 tests done in the last 24 hours. Oh, this is brilliant. 2,000 plus tests done? It's like breaking our own records. So this brings the cumulative number of COVID-19 cases in Zambia to 7,486. Okay? Now, we have also recorded one death of a person who was critically ill at Lady Manawasa Isolation Center. Therefore, the cumulative number of COVID-19 related deaths now stands at 200, of which 179 have been reclassified. We now have 63 deaths due to COVID-19 and 116 COVID-19 associated deaths, and one currently awaiting reclassification. And we know a big chunk of that were brought in dead. So, cumulatively, just to repeat this, the country now stands at 7,486, including 200 deaths and 6,264 recoveries. So we have actually recorded a few more recoveries. And the total tests now stand at 92,341. If you look at the number of people we have in Zambia, the per capita, in terms of per million population, tests are still very low. Do you want to comment on this?
Epidemiologically, and from a public health point of view, it makes a sad reading that today we can have those many people testing positive, and that we continue losing lives, particularly those who are brought in dead. It shows again that community awareness leaves much to be desired. The yield, Doc, from what the minister's presentation gives us is more than 10%. It's very high for a small country like ours. A yield of 10%. It means one person in every 10 is walking with coronavirus. Out of those,
Imagine this is the lowest
exactly.
we have seen in the past few days,
Yeah.
because we had even reached 30.
Yes,
30%.
yeah. So
But still 10% is high,
it's very high.
because all of us here, one of us could actually.
Exactly. And also because they are coming from everywhere. It's difficult to predict where the next infection will be picked from, which tells us that we have now reached what we call a generalized epidemic.
Yeah.
Meaning it's in the general population and it's very difficult to control. This is why we are calling upon the Ministry of Health to invoke other measures to ensure that preventive measures are followed and adhered to, including deploying the army in town, the way they did when there was cholera outbreak. You saw what happened. The town was swept clean. I know we need to strike a dynamic equilibrium or balance between economic activities and preventive measures. But we only have one life.
Yeah.
If this life is lost, you don't get another one. Only one life. It's lost, we don't get another one. I think that the government can do more. And the different leaderships at their levels can do more than what they are doing. We cannot have people behaving as if there is no outbreak. We cannot have a nation where people have no order in terms of following the rules and the regulations as prescribed and proscribed by the Ministry of Health. Let us stop talking and go into action.
Absolutely.
Yeah? More than 10% yield is not a joke. So, for me, I'm calling upon the leadership from the Ministry of Health to invoke other agencies, because it's a multi-sectoral approach, to ensure that, one, everyone wears a mask. If you don't have a mask, don't board a bus. I saw the other day people boarding a bus without wearing masks. People drinking beer without wearing... You can't drink beer while you're wearing a mask. Although I saw in one photo somebody trying to taste food in Livingston, went to opening the tourism with a mask on. That's a story for another day. But we need to do better than what we have done.
That's right.
Countrymen, fellow citizens, coronavirus is real. It is up to us to protect ourselves and the loved ones. And prevention is better than cure. We have the solution within our hands. And the solution is, let us follow what we are being told. Remember, if I protect myself today, I'm protecting you, Doc. If you are protecting yourself, you are protecting me as well. Let us be each other's brothers and sisters' keeper.
Yeah, that's true.
Yeah.
Now, Doc, as we are heading towards the end of this, in a minute or even less, we have one doctor for every 12,000 patients. But where I want to base the question is, we have less than 4 beds per 1,000 population. What should we do urgently and currently in anticipation of high COVID cases? I know we are not like China. We can't build a 1,000 bed capacity hospital in 6 days. But is that something we can do?
There is a lot that we can do. To start with, the ratios you have just given, from a health policy and health systems point of view, for us, that is what we call professionally, that's a scandal. And it shouldn't be allowed to continue. Something has, it's fallacical to continue talking about leadership when we are not providing the health workforce at the required numbers and with the required competencies. In terms of what we can do in order to prepare, Doc, the best weapon for a country like ours, which is resource constrained, is prevention.
That's right.
We need to ensure that each and every household takes the message home that we need to prevent ourselves from being infected, and we need to adhere to prevent. Keep at home, stay at home if you don't have anything to do. It's prevention, prevention, prevention. I would be lying if I said we will be able to maintain and manage a full onslaught of the coronavirus. The next thing we can do, because this one, the saving grace is the weather. When we finally win this battle, I don't want to even see anybody saying we have done it. We should say, glory to God.
Yes.
The weather has come to our aid. It is warm and it has fought our battle. That is all. But let us be proactive and think about the future. In the event another coronavirus came, in the event another epidemic came, are we ready? Is our health system ready to manage and support the patient load that is going to descend upon our very lethargic and weak health system? This is not to say we are not doing enough, but we can do a lot more. And from a health system's point of view, we need to do a lot. Yeah. It is time we introspected. It is time we reflected upon what we are doing. It is time we evaluated our response so that we learn from the gains, we also learn from the losses and the gaps. And we need to embrace everybody that has something to say and something to do about the epidemic. We need to depoliticize the response so that the right people will be present at the right forum, at the right time to share the right knowledge and skills for the sake of Mother Zambia.
Doc, thank you so much.
Thank you, Doc.
This has been Coronavirus and You. Today we've been looking at how the health system in Zambia is responding to this pandemic. Next time on Friday, I will have another guest, God willing, or I might be alone, but whatever the case, we'll be back with another interesting topic where you will need to have an input just like ours. Please, mask up. Respect your distance between you and the next person to you, and more importantly, practice hand hygiene frequently. Please, if you have no reason to be away from your home, stay home. Enjoy your TV. If you can't afford to pay for DSTV or anything else, play with your children. After all, they're not in school. Come on, there is a lot we can do to stop this pandemic. Remember, we did it during the 2017-2018 cholera outbreak. We can also do it. Thank you so much for watching this program. Like I always say, your health is your choice. Bye-bye.